Watch out for rats. Do you know, my nurses and I had a terrible problem with pests on arrival in Scutari Hospital in November of 1854. And do you know, when we arrived, the doctors at Scutari refused to let us in. Women working for the army? They soon had to change their tune when another battle on the Crimean front meant they were overrun with casualties and they needed our help. During the Crimean War, the British and French were fighting the Russians because of arguments over who had control of parts of the Middle East and churches in the Holy Land. The Russians were using nursing sisters to help with the wounded on the front. The French used the Sisters of Charity to care for their wounded. The British War Office, during its preparations for war, had considered sending women nurses, but rejected the idea as too radical. When the Times newspaper found out and drew the comparison with other countries, the government quickly changed its mind. So, here we are, Scutari Hospital. On our journey here, my nurses and I took the precaution of acquiring food and medical supplies, linen, clothing and other basic supplies, as the assurances from the army were not very believable. And it is just as well we did bring supplies. On arrival, we discovered that the army was atrociously under-equipped medically and lacking in all kinds of essentials, including food and bedding. Troops were arriving at Scutari following the Battle of Balaclava. Large numbers of deaths had already occurred from cholera and other bowel diseases at the camps. Soldiers had died on the ships sailing to the Crimea and on the march to the front before a shot was even fired. The men were so weak they had been ordered to leave their kits behind, and these were never replaced. This decision led to enormous suffering as cold weather set in. The wounded from the battle were brought to Scutari by boat, the journey itself taking several days. Many died on the journey or immediately upon arrival. Scutari Barracks provided as a hospital to the British by the Turkish government. It had been built over an open sewer, and a central courtyard prevented the bad air from escaping with no cross ventilation. I've always been fastidious about ventilation to prevent bad air. For a long time, I believed that bad air, or miasma, as the theory from the Roman Empire states, caused infectious disease. Miasma means the vapours emanating from decaying matter. Therefore, cleanliness and good ventilation were critical. Cleanliness prevented decaying matter, good ventilation prevented smells, so disease was prevented. It was not until Joseph Lister's germ theory was first published in 1867, after the Crimean War, that the causes of infection began to be understood. It took a long time to convince me that germs caused infectious diseases. In 1884, my colleague Dr. Sutherland purchased a microscope to study the cholera bacillus, which had recently been understood to be the cause of the terrible illness cholera. And his relating of this discovery to me finally led me to abandon my belief in miasmas and come around to the acceptance of germ theory. Of course, everyone, however, agreed that my methods of cleanliness and good ventilation were, of course, the means of prevention. There were still very few cures for infectious diseases, so prevention was really the only route to take. I would like to read to you my own notes on the state of Scutari Hospital when we arrived here in November of 1854. There were very few beds. The poor soldiers were brought down with scarcely any clothes, their clothes having been worn off their backs. They were placed on mats, and their clothes, at least the remnants of them, were full of vermin. No washing had been performed at the hospital, nor the floor washed for 6 weeks. No washing of linen had been performed. There were no hospital dresses. Neither cooking nor comforts of any kind provided. The whole state of the hospital was pestiferous and infectious, the toilets being in such a state that nobody could approach the place. This is the state my nurses and I discovered when we entered this so-called hospital. Injured soldiers lying on the floor, on mats if they were lucky. Barely any clothes or coverings. What they had was filthy and full of lice. Unwashed floors, unwashed wounds, no attempts at cleanliness, and a terrible stench. Miasma, bad air, everywhere. Any dressings available had been used before and were used again unwashed. I instructed my nurses to set to work. We cleaned the hospital from top to bottom. I wrote to the government and demanded the construction of a laundry and a kitchen so we could provide good nutrition and cleanliness. The death rate did not begin to decrease until the Sanitary Commission arrived in March of 1855 to carry out major structural engineering on the defective sewers, toilets and ventilation of the hospital. We were at last able to provide beds for each soldier in a clean and well-ventilated hospital. I attempted to always ensure that injured soldiers requiring surgery were provided with the new discovery of anaesthetic. Until only shortly before the Crimean War, when reliable drugs and medicines were few, doctors would simply give a patient brandy or port. Fortunately, chloroform was now available to make patients unconscious during surgery. Unfortunately, antiseptics to stop infection for use during and after surgery at this time had not been fully understood. Pain relief was at least available. Laudanum, an extraordinarily strong opium-based pain reliever, was in regular use. During the Crimean War, 19,000 soldiers died from illness, mainly infectious diseases. Only 4,000 from wounds. After my nurses had retired for the night, I would walk the rows and rows of beds through the darkness to ensure the soldiers were comforted, cared for, and not alone. We did not have the wonderful facility of electric light, so I would carry my lamp with me to light my way. A report of my work appeared in the Times newspaper, and I was given the nickname Lady with the Lamp. My time at Scutari was not only spent on nursing the sick and managing the nurses. Being a keen statistician, my role was also an administrative one. I kept notes and wrote reports on the conditions, injuries, illnesses and likely causes of death of the soldiers treated in the hospital. These proved invaluable during my attempts after the war to reform the welfare and healthcare of soldiers in the British Army, and then to improve social conditions and the accessibility of good healthcare for the British general public. I was also given the honour of the first woman to be admitted to the Royal Statistical Society in 1859. I stayed at Scutari Hospital for the duration of the war. The war ended on the 30th of March 1856. I carried on working until the last soldier had recovered and returned home. Then I headed back to Britain on the 28th of July 1856, arriving at my Derbyshire home on the 7th of August. Shall we leave Scutari now? I shall take you back to my comfortable home, Lea Hurst.